This video details the blood vessel lab, and I have 15 minutes to get through the histology and all the blood vessels. So, arteries and veins are actually quite different. All arteries do bring blood away from the heart. All veins bring blood back to the heart except the hepatic portal vein and another portal vein connecting the hypothalamus and the pituitary. Now, they're actually quite different structurally. Arteries tend to have a very thick wall and a thick media and a thick externa. Veins tend to have very thin walls because they're not under as much pressure. Arteries tend to have very narrow lumens, where veins have a very large lumen. So on the lab exam, I will expect you to be able to identify an artery versus a vein. Now, both of them have three layers. There is the tunica intima, or we have the tunica media, and the tunica externa. Again, the media is so much thicker in the artery. Now, some arteries, like the aorta, are elastic arteries. They have elastic tissue all the way through the tunica media. So this is the tunica media. This is the intima. This is the lumen. It's hard to tell on this. And this is the externa. Now, large elastic vessels like the aorta have these vasa vasoriums hiding in them. These are blood vessels that are actually supplying the media and the externa with blood. Most of the arteries that we are dealing with are muscular arteries. We have a tunica intima, and then an internal elastic lamina between the intima and the media. So this is the internal elastic lamina. This is the tunica media. And it's hard to tell, but there's an external elastic lamina too between the media and the externa. So this is the type of artery you are going to be drawing for this lab. This is a muscular artery. So it has an intima, an internal elastic lamina, a media, an external elastic lamina, and an externa. There are smaller vessels also. This is an arteriole, and most of the arterioles only have a tunica intima and a tunica media. That looks sort of like some externa, but I think that's just connective tissue that was around and not actually part of the arteriole. This is a venule. It does not have any muscular layer, so there's no media. It only has the tunica intima and externa. So, you need to draw me an artery and a vein. You need to label the tunica intima, the internal elastic lamina, the media, the external elastic lamina, and the externa. The vein has an intima, media, and externa. It doesn't really have the elastic lamina though. And again, this is an artery. The diameter is a lot thicker, the wall is a lot thicker, and it has a narrower lumen than the corresponding vein. And most arteries and veins like to go together. So this is the aortal slide. You can see what an elastic artery looks like. So all these black fibers are the elastic fibers in the media. This is the intima. This is the externa, and you can see the vasa vasorium, the blood vessels in that. That's another way you can tell that's the externa on this slide. So here's another artery and vein. The artery has a much thicker wall than the vein. The vein has a much larger lumen than the artery. And you can sort of see an elastic lamina right there, and another one right here. It's not that clear on this slide. So here's that slide I'm scanning. The vein is a lot bigger than the artery. I actually see a small artery right there. I could tell it's an artery because it has a thick wall. And that's probably the corresponding vein. And these things right here are actually nerves that are hanging out. This is another artery. The stain did not get the difference between elastic lamina, but I know this is the intima because it is bordering the lumen right here. That's all blood. This is the media, the muscular layer, and this is the externa, or they could call it the adventita as well. Again, I'm pretty sure there's a muscular artery and not an elastic artery, but again, there's no elastic fibers that were stained, so it's hard to tell. This is a muscular artery. Those are some blood cells. You can clearly see the intima right there, though. Internal elastic lamina, media, external elastic lamina is there, then this is the externa. And I'm pretty sure this is the same picture that's in your lab book. You also have to fill in all of the blood vessels in the lab. So I like starting with the heart. There are the auricles. Here is the anterior interventricular sulcus, pulmonary artery, pulmonary vein, arch of the aorta. The arch of the aorta has the brachiocephalic artery, which splits to become the right subclavian, and then the right carotid is on that side. And we have then the left carotid going up, and it splits right here to become the internal and external carotids. And this little branch right here is the superior thyroid artery. There's going to be a branch of this coming underneath the jaw and going up the face. This is called the facial artery. This artery right here, you guessed it, is the temporal artery. There is an occipital artery coming back here as well. That's not on this mannequin. And then the maxillary artery is going across the zygomatic arch right here. Now for the veins, that is the subclavian vein. This is a subclavian vein. This is the brachiocephalic vein. Brachiocephalic artery, brachiocephalic vein. This will become the jugular. This right here is probably going to be, or supposed to be, the vertebral, except it looks very large to be the vertebral. This is the mannequin from the other side, so you could see the brachiocephalic vein splits. Here's the subclavian, and here's the jugular. So this is actually a lymphatic model. You could see the thoracic duct right there very clearly. There's the cisterna chyli. And I like it because it shows the veins. This, in theory, should be the basalic vein, and this should be the cephalic vein. And they come and they join in on the vena cava. Here, in theory, because this is the lateral side of the arm, that is the cephalic. The basalic should be on the medial side of the arm. We see the occipital vein coming down. We see the temporal vein coming down. We see the facial vein coming down for the jugular vein. And then this would be the femoral vein and the great saphenous vein coming up. And my favorite vein is right here. That is the hepatic portal vein. So this is the arm. This is the subclavian. It magically becomes the axillary, and then it magically becomes the brachial artery. It splits to become the radial, because that's the thumb side, and the ulnar. Usually these can be found on the cadaver. Now, there are deep veins and there are superficial veins on the arm. The superficial veins, this is the cephalic, this is the basalic. I don't know how well you could see it, but there's a crossing right here called the medial cubital vein. Right at the elbow, this is where the phlebotomist draws blood from. They are the superficial veins, so cephalic and basalic. And the basalic goes and merges with the brachial vein. The cephalic comes up here and hits the axillary vein. Now you also have deep veins. Those would be the radial on this side and the ulnar on this side, becoming the brachial. This is the outside of our vascular head. So the carotid splits into the external and the internal. And you can see a vessel in here. These are the vertebral arteries that are going to go up and sneak in through the foramen magnum. Now, here we have the facial, we have the maxillary, we have the temporal, and then this is the occipital. This is our lymph mannequin blown up. This vein right here is the hepatic portal vein, and then this one is the inferior vena cava. So we have the aorta, we have the vena cava, and we have the iliac arteries right here. And the common iliac artery splits into the internal and the external. When the external iliac artery clears out here, it becomes the femoral artery. There's actually a deep femoral artery that just runs right here by the femur, and then you have the femoral artery proper that runs the entire length. It magically becomes the popliteal artery right here. The popliteal artery is going to split to become the fibular artery, which is on the lateral side of the leg. The anterior tibial artery, which is going to come down the anterior of the tibia, and the posterior tibial artery, which comes down here. The veins follow the same one, so this would be the fibular vein. This would be the anterior tip. Oops, this one right here would be the anterior tibial. This vein right here running up the entire inside of the thigh is the great saphenous vein. And this is a site of IV injections if they cannot get it in the medial cubital vein. So remember the vertebral artery coming through the foramen magnum and the internal carotid artery coming through the carotid canal? Well, they're going to merge to form a structure called the circle of Willis. The vertebral arteries merge to become the basilar artery, and communicating arteries come off of the carotid artery. You have an anterior communicating artery connecting the left and right carotids, and you have a posterior communicating artery, not only connecting the two carotid arteries, but it also has the basilar artery. This has 3 arteries going into it, technically 4 if you count those. And it's actually a site of a lot of strokes. This is the posterior cerebral artery. This is the middle cerebral artery. These are the anterior cerebral arteries. We have the circle of Willis on this vascular head and actually on the meningeal model, so it can be used for both. The abdominal cavity is complicated. So we have the aorta coming down, and this is now the abdominal aorta, and it branches into the common iliac arteries. This branch is the internal iliac. This branch is the external iliac. Now, there are 2 paired arteries coming off of it. This is one pair, and then this is the other pair. This lower paired artery is the gonadal artery, so that would make these the gonadal veins. And the second one is the renal artery, which would make that the renal vein. And again, the iliac arteries, or veins, are paired. We have the external iliac vein coming up here, and we have the internal inside here, and then it becomes the common. This can also be asked on the pelvis model. Now there's 3 arteries, 1, 2, 3, that come off the middle. This is the sciatic trunk. It is going to form the splenic artery, it is going to form the hepatic artery, and it forms gastric arteries that are going to supply the stomach and the esophagus. The hepatic artery goes to the liver, that's right here, and the splenic artery goes to the spleen. The superior and inferior mesenteric arteries go to the small intestines. This model gives students a lot of grief, I think, because it's taken out of the abdominal cavity. So we have our adrenal glands, we have our kidneys, we have our spleen. This is the pancreas. This is the duodenum, which is the first part of the small intestines. So, the sciatic trunk is right here, and the splenic artery is coming off of it going to the spleen. This is the splenic vein. That is purple because it becomes part of the hepatic portal vein. These are probably mesenteric veins, and they joined the hepatic portal vein, which actually goes back to the liver. This is the superior mesenteric artery, and the gastroduodenal artery is right here. Now, on the back side of this model, we can see the vessels more clearly. There's the sciatic trunk. We have a little gastric artery coming off. This is the splenic artery. This is the hepatic artery. This is the splenic vein going to the hepatic portal vein. This is definitely the hepatic portal vein. We have a renal artery and vein right there. Then this is the superior mesenteric. So this is the model we actually have in the classroom. It's very similar to that. The one I just showed you was in the student center. That is all the time I have for the arteries and the veins on this. Thank you very much. Have a good day.